This is the classic kid who talks too much in class, doesn't listen, doesn't get his homework done, and usually is kind of butting in line and causing problems. It's more common in males and usually presents between 3 and 13 and often runs in families. So the DSM-4 criteria I've kind of simplified here. You got to have these symptoms for at least 6 months, and you got to have 6 symptoms, either in the inattention category or the hyperactivity, impulsivity category, which I'll talk about in just a second. And the symptoms have got to show up before 7 years, and they got to show up in 2 different settings, so at least like school and at home. It can't just be one or the other. And it has to have significant impairment, so it makes it so these kids don't function very well and have problems in social, school, or work settings. And we got to rule out other disorders. So the big numbers to remember are 6 for 6 months, 6 for 6 symptoms, 7 is the age that you got to have impairment by, and it has to be in 2 settings. So the inattention category is the area where the kids have a hard time just paying attention to details. They're making careless mistakes like leaving their name off their paper or not finishing a sentence. Inattention while you're working on homework or playing a game. So the kid might be in the outfield kind of looking at birds instead of watching for the ball to come. And poor listening, even when somebody's speaking directly to them. Doesn't follow instructions, but you got to differentiate this from the oppositional kids who aren't doing it because they don't want to. But these kids may be willing to do the work, but they just kind of forget or weren't listening when they were told to do it. They have trouble organizing activities. Avoids things that take a lot of brain power, at least for long periods of time. Constantly loses things. Often easily distracted, forgetful in daily activities. So these are my symptoms here, but I don't have the hyperactivity symptoms. Fidgeting, getting up from the seat, running and climbing on things you're not supposed to climb on. At times you're not supposed to be doing that. Trouble playing quietly. Parents will say they're always on the go. It's like they're driven by a motor. I talk excessively. Teachers will say they're blurting out answers before the question is done. They don't wait their turn in line. They butt into conversations and into games that they weren't invited to play in. So they end up getting in fights, and a lot of times people don't like them for these things. So the subtypes, there's the predominantly inattentive subtype, and this is what we used to just call ADD, and I don't really understand the rationale for renaming it, because you can have, for example, 7 or 8 inattention symptoms and no hyperactivity symptoms, and you're still called ADHD, which involves the hyperactivity. So I don't know exactly why they did that, but I guess they figure this is all the same disease, even if you don't really have the hyperactive symptoms. And if you have mostly hyperactive symptoms and none of the, or few of the inattentive symptoms, you're the predominantly hyperactive, impulsive type. And the ones that have both categories of symptoms, those are the ones that usually show up early on in life in the doctor's office, because they're driving their parents, their teachers crazy. So on your differential, you got to rule out any kind of mental retardation, whether due to Fragile X or other more subtle mental retardation syndromes. You also need to rule out sensory impairment. A lot of times these kids just don't hear well. You can't see the board, and so it seems like they're not listening. Lead poisoning you don't really see as much anymore. Asthma, I don't know exactly how that ends up looking like ADHD. Thyroid problems, some of these hyperthyroid kids get pretty revved up, or the hypothyroid may have a hard time paying attention. Kids that don't sleep well are not gonna pay attention in class, and the kids with the petit mal seizures are gonna blank out for a second, and it seems like they're not paying attention, but they don't even remember it. So ask a few questions when the child comes in, just to make sure that you know how the child is doing in school and at home. Some of the parents aren't going to come in and tell you all these things. So make sure you're asking the questions. The Vanderbilt scale is an improved scale for kind of quantifying these symptoms. So for treatment, behavioral modification is first line if the problems aren't too bad. So this is things like providing a real structure at home. Usually schedule is important here, making sure you're getting up at the same time, going to bed at the same time. Right after school, you go and do your homework before you watch TV. So you keep a real schedule. Also, you keep the home really organized. Everything has a place. Try and get some organization in the classroom as well. And a lot of people are associating this with sugar and food additives. There's not really any good research on that. But I have some friends that swear that, some red food dye. I can't remember the one that is called they talk about, but some red food dye they say is absolutely associated with their kids' ADHD. So it's up to you to try out, but there's no good research for it. The drugs, classically we gave everybody Ritalin. Now I don't hear about people giving as much Ritalin, but more the Adderall, Strattera are pretty common from what I've heard. And so these are all stimulants: methylphenidate, dextroamphetamine, and amphetamine, atomoxetine, pemoline. So these are, basically like meth. They are stimulants. They make your make things go a little bit quicker in your brain, give you more energy in a lot of cases. So those are also in the side effect category too. You can get a little bit irritable, have a hard time sleeping. You don't need to eat as much, so a lot of times the kids will not grow as well. And tic disorders, which are correlated or associated with ADHD, can get worse when you give them these medications. So some of the Tourette's type syndromes can be exacerbated by stimulants. Antidepressants can be used, as well as alpha-2 agonists. I don't know as much about that, but apparently those are also used in treatment, especially if there's some